thank you very much for joining us today. It is really an honor and a treat to have you here to recognize the City of Lubbock's Public Health Department as our Business of the Month. Not a usual occurrence to have a city department recognized as such. Not that we don't really appreciate all the work of the city, but this last year has just been historic in all the things that we've been able to accomplish. And you've been on TV, radio, phones. I mean, everybody knows who Katherine Wells is, but give us a little bit of background so the folks who might be watching today get a little bit of background personal about yourself and how long you've been in your current position.
Yeah, sure. I guess a lot of people don't know about me too much personally. I've been here in Lubbock for about 7 years now. My husband and I and a small child at the time moved here for him to attend Texas Tech. I'm actually originally from the East Coast, grew up right outside Washington, D.C., and went to school out there and never imagined myself in West Texas, but we definitely love it. And we've decided that this is where we're going to stay to raise our family.
Now, in the public health department, you've led it through quite a transition, even before, obviously, what we're getting to talk about the pandemic. And so you got here right in the middle of essentially changing gears and going in a different direction, didn't you?
Yeah, one of the questions I actually asked the city when I was interviewing was, am I going to be able to rebuild public health? And at the time, those who were interviewing me said yes. I don't think they knew what they were agreeing to, but I've definitely been able to grow the department. We've added a lot of additional programs, and I'm very excited that they're looking at providing us a new home, which will be a permanent home for public health here in Texas or here in Lubbock.
Well, and I think that's all an attribute of what you brought to the office. So on that behalf, I mean, I can't think that there hadn't been a better person that was sent here to do this. So not only what you were doing previously, but also what you're going to be doing past this period in time. And although you're highly trained at what you do with your job and you've been doing it for a while, but did you ever expect in your wildest imagination that you'd be leading us through this pandemic like you have for the last year?
No, I never thought about it. I have my master's degree in public health, and, they talk about pandemics, but it's always for, a week or a month. We never thought about it impacting, the U.S. economy, our healthcare system, all of us individually. I don't know a single person that hasn't been affected by COVID in some way. I just never expected the public health department to have such a prominent role for so long.
Well, and having the opportunity to have served with you with the Lubbock Economic Recovery Task Force, I'm obviously very familiar with the decisions that you face on a day-to-day basis, on an hour-to-hour, sometimes minute-to-minute basis. So we really appreciate both your ability to respond, as well as obviously what you've done to provide a little bit of calm and awareness in our community. But for you and your team, I mean, you're here because we think that y'all have done an outstanding job on behalf of supporting the business community. What do you think, if you were to say some of your greatest, the things that you've done well and what you're most proud of over the last year?
Oh, I'm definitely the team. I've been honored to lead such a great team. And really over the last couple of years, we've been rebuilding our public health team, and we now have 45 full-time staff here. When I started, there were 10. And I think we've made some really good hiring choices and been able to bring some really smart people into the department. I think we did great at the beginning, getting on board with contact tracing, understanding really where the disease was coming from, where we were seeing spread. My background's actually in epidemiology, so that's my favorite part of public health. And I'm kind of a data nerd. I like to get in there and really get down into the data. But I think we were really well positioned to start with that contact tracing. I think we were able to bring in a lot of the partnerships that we've built over the years, being able to talk to our hospitals and business community and nonprofits about what was needed in Lubbock, and really kind of set up some of our, what we were going to do locally in response, really working with those different groups. And I think now I'm most proud of that vaccine clinic. We're seeing, minus the snow last week. I mean, our goals
really slowed a lot of things down.
It slowed down a lot of things, but really to have, the goal of having 10,000 individuals vaccinated through there each week, and the number of volunteers and city departments that have stepped up to help us has just been incredible. And, I'm so thankful to be in a city like this where you can get that cooperation.
And the cooperation is a two-way street. So thank goodness that you've had that relationship building experience that you had both before building up the department as well as during this entire time. But I think it's very fair for all of our folks that are paying attention that what y'all have done for the business community to keep us in operation as much as y'all have been able to do. It's very important for folks to understand how accessible that you have been and all your team, and how important that information flow that you've shared with us have been so important to us. And that's a good segue as far as your relationships that you've built with all the hospitals and the medical community here in town. Now gives you a chance. Okay, what's next? When are we getting out of this pandemic?
Yeah, I don't know when we're getting out. I really hope that this fall we can be kind of back to normal, have football games and enjoy some tailgating and, all the things I miss too. But after that, for the health department, we're really working on building some new programs. I think a lot of people aren't familiar that we took over all of the services that were formerly at managed care. Mm-hmm. We absorbed all of those contracts for substance use disorder and treatment. So we're going to be working on really building those programs and having more robust services in our community. And then also getting back on board with all of our other public health initiatives. Lots of kids didn't get vaccinated this year because of COVID. We didn't get to do a lot of our planning. We didn't get to bring in the trainings we wanted to bring in for our community. So all of that's, we're going to get all of that going again next year.
Well, it's not often I get to share the Zoom screen with such a celebrity here in town. So it's a nice chance to visit with you, Katherine. But again, on behalf of the Chamber of Commerce, thank you so much what you're doing for our entire community, but especially helping us businesses stay on our feet and those who haven't been as easy to succeed to get back on their feet. So Katherine, again, congratulations. Thank you. And please get back to helping the community. I won't keep you away from your business anymore.
Well, thank you. I appreciate it. And thank you for the honor.
You bet, Katherine. Thank you very much.